In this week's To Your Wellbeing, WFMY News 2's Tracy McCain is breaking down the new science and increased hope for a cure.
In April, Tina Hinshaw heard the words no cancer survivor ever wants to hear.
I'm really sorry, but I think you have cancer.
Her breast cancer was back. Her second battle was about to begin just 2.5 years after beating it the first time.
Going through it right now. Yes, I've just completed chemotherapy, and I have had a revised mastectomy on the left side.
Hinshaw caught it early, discovering the initial lump during a routine self-exam in 2016.
Even though I only had cancer in one of the breasts, I went ahead and elected to have both breasts removed and then had implants put in.
The chances of a recurrence after a bilateral bisectomy are slim, less than 5%. So when she caught the second lump during a self-exam this year, it was an even bigger shock.
I know all the statistics. I know what breast cancer looks like, and it almost fooled me.
She knows the stats because she's usually on the other side of healthcare.
I build diagnostic imaging centers, and I work for a diagnostic imaging company, and now I'm going to be a patient, and that's not what I had in mind.
But she's determined to beat it again.
It's curable, it's treatable, it's okay. There were some really dark days, but not nearly as dark as I thought they would be.
New advancements in cancer treatment are providing light.
It seems like every day we're coming out with new regimens or new drugs from pharmaceutical companies that really help advance cancer and advance the treatment of cancer.
Dr. Timothy Finnegan, a medical oncologist at the Alamance Regional Cancer Center, says one of the most common forms of treatment can be avoided if the cancer is caught early enough.
I like to tell my patients as I give chemotherapy for a living, but I do everything I can not to give it.
Dr. Finnegan says advances in screening and treatment for breast cancer have improved survival rates dramatically since 1989. According to the American Cancer Society, the chance of a woman dying from breast cancer is around 1 in 38, or 2.6%. That's down 40% in the last 3 decades.
The majority of cancers that we treat here, we treat them, they go away, and they're gone forever, essentially. But there's still, the percentage of coming back is not zero.
Dr. Finnegan reminds women at risk over 40 to get screened.
My number 1, 2, and 3 recommendation is to make sure they get those yearly mammograms.
Hinshaw says she's thankful to be a living example.
There's hope. There's so much hope in it, and the earlier you can detect something, the better.